Hello, everyone, and welcome to the Dane County Podcast. I'm Dane County Executive Joe Parisi, and joining me today is Casey Becker. Casey is the Division Administrator of the Dane County Division of Housing Access and Affordability. It's a lot of words, and it actually makes sense because Casey does a lot of work. We're going to be talking today about housing and homelessness, and that encompasses so many general areas just specifically to the issue itself. But we also know that housing access is at the root of so many of the challenges people face in our community and others. So we're really glad to have Casey here today to tell us a little bit about what her office does and help us understand better the situation surrounding homelessness and housing availability and accessibility in Dane County. So welcome, Casey.
Thank you. I really appreciate you inviting me to be on and for raising up this issue. I'm a big fan of the Dane County Podcast, so Excellent. I'm happy to be here.
Excellent. We have a fan of the podcast on today. It finally happened. That's great. So, Casey, could we start by you just telling us, a little bit about your division and what you do? Now, this is a relatively new division. We created it a few years ago. In response to a growing need in this area. Could you tell us a little bit about you and your team and the different things that you work on?
Sure. So the Housing Access and Affordability Division is one of several divisions in the Dane County Department of Human Services. And our division, our charge is supporting programs and partnering with agencies in Dane County to prevent and end homelessness, to increase access to affordable housing, and also to support efforts for economic and workforce development. So we have a broad array of partners that we work with. There's a lot of different work that we do in collaboration with other entities in the community, and a lot of different programs that fit under those major focus areas.
Yeah, Casey, there's so much to this situation. I think we all have our experiences with and concepts of homelessness and of housing challenges. Could you give us kind of an overview of, what is the situation in Dane County with, and again, they're interrelated, obviously, but not always directly. What is the situation with homelessness, with housing? What are the kind of issues you work on, and what do you see out there?
So, as I talk about this, I always like to acknowledge that the numbers I'm sharing represent people in our community, represent our neighbors. So I'll be using a lot of facts and figures, but I always like to make sure that I say in the beginning that those are all attached to our neighbors in Dane County who are experiencing homelessness or housing instability. I also want to make sure that I acknowledge that there's a lot of frontline agencies who are doing this work directly with customers every day, directly with people in need, advocates who are raising up this issue, elected officials such as yourself who are supportive of these issues, and members of the public who have a lot of compassion for these issues too. So it's definitely a team effort across a lot of different sectors. So when we talk about homelessness in Dane County, there are a number of different ways that we measure it and define it. And some of that's driven by the funding sources that we have for a lot of these resources. One of the ways that we define it is by the number of people who are unsheltered, or the number of people who are staying in emergency overnight shelters. So people who might be sleeping outside or in their car, or people who are utilizing our shelter system. One of the ways that we count how many people are experiencing homelessness in our community is the point in time count. On any given night in Dane County in 2022, there were over 700 people who were experiencing homelessness. That includes families with children. It also includes adults who do not have minor children in their care. Another one of the ways that we count it is the number of people who are served by the system throughout an entire year. And that number was about 2,800 people. We also recognize homelessness can impact people in different ways. If people may not be in a shelter, they may not be sleeping outside, they may be self-paying in a hotel, or a motel, or they may be staying with a friend or with family. They're not on that person's lease. It's not a formal arrangement. It can be really precarious in a lot of cases. We refer to folks in that category as doubled up, or you might hear people refer to doubled up homelessness. And to get a sense of the scope of that segment of the population is a little more difficult, because programs that have been funded by the federal government historically have not, that population hasn't been eligible. So we're here at Dane County starting down a path of getting a better idea of how many families are impacted by that kind of homelessness, how many households and how many people.
So the 700 plus at any given time, that's folks who are unsheltered. That doesn't count folks who are doubling up or staying with friends.
Correct. So point in time count, 700 people in Dane County. That's one day. Volunteers will go out. Shelters will provide their numbers for how many people stayed in shelter that night. Volunteers will also go out and try to count folks who they know might be staying outside. The 2,800 people I referenced, that's information that we receive from our agencies for the total number of people who are served in a number of programs throughout the year, served in shelter and transitional housing. So that gives you an idea of how many folks throughout the year. And then when we talk about that doubled up population, we often take a look at school district data. So Dane County school districts identified around 1,400 students who were experiencing homelessness. That includes kiddos who might have been staying in shelter, and also includes kiddos who are doubled up. And the other thing that we've been taking a look at is census data. And so we took a look at the 2019 census data, and based on some assumptions, in ways that other communities have tried to estimate how many people are doubled up, we came up with a figure of around 5,600 households that could be doubled up in Dane County. There's a new position in my division that was created last year to focus on program development and policy development to serve households that are doubled up. And so Janisha Prescott is the person on our team who focuses on that and has been working on ways that we can increase the number of resources that are available to that population of folks who are experiencing homelessness. So a lot of definitions, a lot of ways to count the scope of who's impacted in Dane County. And then beyond the numbers, when we take a look at demographics, it's always important to keep in mind that folks who are experiencing homelessness reflect our community. Families, grandmas and grandpas, young adults. There's a lot of people with diverse backgrounds who are also experiencing homelessness. Some of the major trends are that, unfortunately, people of color make up about 49% of people experiencing homelessness. They're severely overrepresented in our homeless population. And the other thing that some folks wonder is, where's the breakdown between single adults and families with children? The majority of folks experiencing homelessness are single adults without children, but there is a large number of families that are experiencing homelessness on any given night.
Yeah, and that's really heartbreaking. Obviously, anyone experiencing homelessness is horrific. But when you see how many children are experiencing homelessness at any one time, it's really frustrating. It's really challenging and sad, because there is so much effort put into it, but situations happen, and there are a lot of people who need help, and some of these young people end up in these situations, and we try our best to help. Casey, could you talk a little bit about both, kind of what the county's involvement is, what we do, our efforts is related to homelessness, and then maybe kind of, it might be interesting for folks to kind of get an idea of the overall environment, like where are the different shelters and who runs them, and when, what is their purpose, what do they offer, when do they offer it, kind of what is the scene out in the community between the county and all of our partners, is as far as trying to help people who are in need.
So the county traditionally Our role has been as a funder and as a collaborative partner. And as a collaborative partner, that means a lot of different things. My staff, we have a community development block grant unit, and we have a housing stability unit. And so our housing stability unit is often in a lot of conversations with our homeless services consortium. That's a group of agencies and advocates who provide services and advocate for services in homeless and housing in Dane County. So we are walking side by side with those agencies to identify system improvements, to escalate needs that the system has to our public officials in Dane County, to identify trends, to try to problem solve, to try to capture opportunities. There's a lot of community planning that goes on to make sure that we're on track and that we're aware of the gaps in our system and coming up with innovation for how we might be able to address those gaps. And so my staff and other county staff outside of our division are very present in a lot of those collaborations. In terms of funding, funding is really important, but as is true in a lot of areas, there's not limitless funds to be able to address a lot of the really serious issues in our community. So we try to use those dollars as efficiently as we can, and for people who are experiencing the highest need. Dane County historically has made our investment in the shelter system, in emergency overnight shelter, day shelter at the Beacon Day Resource Center. Dane County is the second largest funder of homeless and housing services in Dane County. We're second to the federal government, to the Federal Housing and Urban Development Department. They provide funding through our community that the city of Madison helps manage. And consistently, for much of that time, we've focused that investment in emergency shelter. In the last 7 years in particular, the county has greatly expanded its investment on the housing side, both for programs that can help people experiencing homelessness get access to case management and rental subsidy, but also in the area of developing new housing units, most notably through the Dane County Affordable Housing Fund. That fund's been in existence since 2015, and since that time, it has invested over $30 million into creating over 2,200 units of affordable housing in Dane County. And in 2023, thanks to your efforts and the efforts of the county board, we'll have $10 million to grant out this year to help support affordable housing. I also like to point out that the investment that Dane County makes is all county dollars. It's all tax revenue, general purpose revenue. We don't have federal or state match for the money that we supply for shelters and housing programs. It's a commitment that Dane County has because it's something that people care about. They believe it's the right thing to do to be able to provide that critical safety net for our neighbors experiencing homelessness. I talked about shelter and outreach. That kind of falls under the crisis bucket. We work with agencies like Porchlight, the YWCA, Salvation Army, Catholic Charities. There's a number of outreach organizations. The one that we contract with is Catalyst for Change. There's also our prevention bucket. So emergency rental assistance if people fall behind in their rent, legal services if they need assistance with tenant rights or the eviction process. The county is currently one of the funders and a member of the community collaboration called Dane Corps that's providing tens of millions of dollars of emergency rental assistance for people who might need to access that. And our partner in that effort is Urban Triage that helps administer those funds for us. And then two other buckets that I would mention would be tenant support. So those people who are in housing and might need stability services. So maybe they need help paying forward rent. Maybe they might need some case management or connections to employment and training. We have a number of workforce development partners who we've worked with traditionally. Latino Academy, Operation Fresh Start, Big Step, the Boys and Girls Club, and also permanent housing. So programs that help people access case management and rental assistance so they can move out of homelessness and into housing and have a little bit of a support to help them stabilize in that housing and maintain that housing long term.
Yeah, it's a lot. And really what you're talking about is this continuum of services, right? I mean, when someone finds himself homeless and is experiencing homelessness, our goal is to first do everything we can to help keep them safe and sheltered, and then help them address the challenges that resulted in their being without housing at the moment. So the first kind of level of that triage is the shelter system. Could you just give us a brief overview of what that looks like, what's out there, the various shelters, and who utilizes them, for example, families, single women, single men, et cetera?
Yeah, so Dane County is fortunate in a lot of ways because we have a shelter for adult men, we have a shelter for adult women, we have a shelter for families, actually 2 shelters for families that are not overnight only. They allow families to stay for a little bit of a longer period of time. Salvation Army and YWCA operate those programs. We have a shelter for youth who are experiencing homelessness or who work with Briar Patch to access resources and reconnect with their families if that's safe to do so, or reconnect with other supports. I also like to mention the Domestic Abuse Intervention Services shelter. We're very lucky to have that resource in our community as well for survivors of domestic violence. And so those shelters are primarily located in Madison, in the city of Madison or near the city of Madison. There are some other programs I didn't mention that might be in other communities in Dane County. Shelter from the Storm, for example, is a shelter for families in Sun Prairie. And a lot of community organizations that support people experiencing homelessness outside of the city of Madison in other ways that are not shelter. So the services for sheltering, however, are pretty concentrated in the city of Madison. Oh, and we also have the Beacon Day Resource Center.
That's right.
Which, a major initiative that was led by Dane County, opened in 2017, and enabled a lot of really important connections in our community to be under one roof for people. Open 7 days a week, open 365 days a year, a place where people can have their basic needs met, like mail, shower, laundry, food, but also connect to partners to help with employment and training, housing, and a lot of other needs as well. The Beacon has been a total game changer for housing and homeless services. Before, people used to have to go to several different places throughout the day to have their needs met. And so that's been a really welcome, really impactful community resource that Dane County has helped support.
Casey, what might that journey look like? So once someone is in emergency shelter, and as we talked about, there's so many different circumstances that could result in someone needing shelter. But could you talk a little bit about, if and when it's working its best, what could that continuum look like? Someone finds themselves homeless, what's next, and how can they, journey through a place of having a house, a roof over their head?
Yeah, the goal of our Homeless Services Consortium and all of the partners that we have in this work is that homelessness is brief, rare, and non-recurring. So what that can look like when we have access to the resources we need is that if someone does have to access emergency shelter, if they're not able to stay where they are, maybe they're doubled up, or maybe they just need a little bit of help to stay in their doubled up situation until they can get into housing. That is typically referred to as diversion. We have those resources embedded in some of our shelter models. If somebody cannot stay safely or stably doubled up, then they would enter the shelter system. In the shelter system, folks have access to case management, food, other supports, connections to other community resources for things that they might need, like medical care. At shelter, a number of different things can happen. A person might be able to connect to some rental supports and be able to exit homelessness from shelter, or they might be enrolled in various housing programs where they'll have assistance finding housing, a rental subsidy to help them pay for housing for a limited period of time, and then also access to ongoing case management. For some folks who have more acute needs, there are also programs called permanent supportive housing. And so that is a long-term rental subsidy. It's not time limited. The person has help paying their rent for as long as they need to. There's usually these units or these housing placements are in our community in a lot of different sites. And that person also has consistent access to case management throughout their time in the program too. So ideally, you have people moving into housing opportunities. And then if they are enrolled in one of those housing programs that I had mentioned before, the ones that aren't our permanent supportive housing options, you often see people, it's referred to as rapid rehousing. You may see people exit those programs and be able to pay their rent and maintain their housing after 6 months in the program. That's usually the average rate we see among families experiencing homelessness. Among people who are single adults, that can take a little bit longer, but eventually that person would successfully exit that program and be able to maintain their housing. And then following that continuum, somebody is in their housing, they might need some additional support once they're into housing. We do have a number of those housing stability and eviction prevention programs as well. Maybe somebody had a car emergency or a large medical bill, or they're in between jobs and they need a little extra help. So they need some rental assistance. The Dane program exists now, and we had eviction prevention funds before, although a lot more limited, that could help people pay back rent if they needed help in a given month. So then there's those efforts on the other end of the continuum once people are in housing to be able to make sure that they can keep their housing too.
Yeah, thank you. That's interesting. And gosh, it's so frustrating, that we know that so many people are a medical emergency away from potentially being without a home and a place to lie their head at night. But that's a whole separate issue that has frustrated folks for a lot of time. So, Casey, when we look at the overall population, what's your best estimate of how many folks are kind of chronically homeless who have been and might be in the system and might be without shelter for various reasons, kind of longer term, however we want to define that, and how many fall into that category of maybe up to 6 months that you mentioned? What does that look like? I ask this for a couple reasons. It's interesting to know, and also because we often talk about our quest to end homelessness, which obviously is a goal that we should all embrace. But the reality on the ground is you could end homelessness for everyone who's without shelter today. And tomorrow, because of circumstances, some of which you mentioned and others we haven't talked about, people are going to find themselves in need of help and homeless, hopefully temporarily. So what does that population look like as far as how long they're in the system before they can get the help they need?
A majority of folks who are in shelter are going to be in shelter. They're going to utilize services. They're going to exit after a certain period of time, and then they may not return to that resource and they may not need it. And so that's the majority of folks who are served in shelter. We do have a smaller segment of our population that is, as you mentioned, chronically homeless. So people who have multiple prolonged episodes of homelessness, people who may have a disability. And so that's a smaller segment of our population. The last time I checked our by name list, which is a housing referral list that a lot of housing programs look at, I think we had around 200 people who are single adults experiencing chronic homelessness. So it's a smaller portion of our total population that we serve, and those are typically the folks who we are working to help them access that permanent supportive housing intervention that I mentioned. That's also our smallest intervention. That's definitely an area where more units and more growth would be really helpful. You had mentioned a world where homelessness would be eliminated, and I think that would obviously be wonderful. But acknowledging our reality, which is that we have a lot of really large systemic challenges, not only in Dane County, but throughout the entire country, throughout the entire world, that lead to this manifestation of homelessness. We have historic housing discrimination and institutional racism that's created racial disparities in a lot of different areas. We have wage stagnation and the wage gap, access to healthcare and to behavioral health supports, and just not enough places for people to live, not enough homes, not enough apartments. And when we do have homes or apartments available, they're often a considerable share of the money that people are taking home from their jobs, more than 30% of their income for some folks who are severely cost burdened. And we're not seeing the movement through that housing continuum that we used to see. People aren't able to afford a home, so they can't move out of their apartment. They can't open up a spot in an apartment that might be more affordable for somebody else. So what we try to do is to do our best to invest and support in a system that does make homelessness brief, rare, and non-recurring. And we do that by creating the right amount of capacity and shelter in those housing programs I mentioned that people can transition to from shelter. And then the work that we do through the Affordable Housing Development Fund and through a lot of other efforts to raise up the need for more affordable housing to help create those additional units too.
You mentioned just being able to find a place for people. And, you and I were talking the other day about the housing gap. I'm wondering if you could talk a little bit about the housing gap, what that is. You alluded to it somewhat. And maybe then if you could, tell us a little bit about your division's housing efforts. You mentioned the number of units, kind of in context of that gap. How does that work? I know we partner with other funders in an effort to help developers develop more affordable housing. Could you talk about the gap, talk about how your division works and some of the types of buildings that have gone up due to these efforts?
When we reference the housing gap, we reference the amount of housing we need based on the growth that we see in Dane County. And Dane County is the fastest growing county in Wisconsin. People come to live here because it's an amazing place to raise a family, to go to school, to work. And so we know we need a lot of housing every year to keep up with that growth. In 2019, we had a housing assessment done in partnership with Professor Kurt Paulson from UW-Madison. And at that time, it was estimated that we needed at least 1,000 units of housing a year to keep up. We were already down units based on our population growth, and we needed to at least have 1,000 a year to keep up. I mentioned the Affordable Housing Development Fund. It's a tremendous resource. It helps incentivize the development of affordable housing. And we've been able to support the creation of 2,200 units since 2015. So creating this new housing is expensive. It takes time. No one entity can be the solution. The funds that we invest through the Affordable Housing Development Fund are one piece of a lot of different funding components that a developer puts together when they're getting ready to develop an affordable housing project. So that has been a really helpful tool because often the county's money can assist developers in building units in parts of the county that may not have a dedicated housing fund. So the city of Madison, for example, we partner with them quite a bit. We have funding in the same projects a lot of the time in the city of Madison. Some other communities are building momentum around those housing issues and thinking of the different tools that they can implement. So over the last 7 years, because of the increased awareness of affordable housing, we've seen the number of communities applying for our fund outside of the city of Madison grow. We had maybe a few in 2015 when the fund was first created, and now it's at least half of our projects are in the city of Madison, half are outside the city of Madison, or a majority are outside of the city of Madison. So that's really encouraging to have those partners in other municipalities who want to be a part of the solution. Affordable housing, I think people, some folks might have an idea of what it is. And I think it's always good to remind folks that there's a diverse swath of people who need affordable housing because our vacancy rates are so low, the number of units that are available are so low because the costs are so high. It's people with low to moderate income, but that includes nurses. It includes caretakers, teachers, police officers. There's a lot of people, seniors, who may not be able to maintain a large house, but who want to stay in their community in maybe an apartment that they can afford. So this is impacting a lot of people in our community and a lot of our neighbors. And I've been really excited by the partnerships that we've been able to build. One of the internal county partnerships that we have is with Olivia Perry in the Dane County Planning Department. She staffs the Dane County Housing Initiative. And so she's crisscrossed Dane County talking in different communities all over about the importance of affordable housing. What does it mean? What does it look like? How can we partner to make more of it? And she's also helped to put structure around and launch the regional housing strategy that my division also participates in with a lot of other community members. And that is underway. There's been a lot of really good sessions. People who are there have come up with a lot of really good, innovative ways to look at the issue. So I'm excited to see what will come from the end of that planning process and what new and exciting things we can do.
Yeah, thanks. And thanks for giving the shout out to Olivia. Olivia, if you're listening to this, thank you so much. I hear you talking about, Casey, how the phenomenon we've witnessed over the last number of years of more and more people, more and more communities being interested in and getting involved in developing affordable housing. And a lot of that is due to the work that first of all, people are becoming more aware of the need, but Olivia has done such an amazing job of reaching out and bringing communities together and helping people understand the resources available and how to and why. And it's just been really good to see that expanding beyond the city of Madison. So thank you. Yeah, and that's the thing. I mean, boy, we could start naming people. There are so many, if you're ever feeling down about life in the world, all you have to do is start looking at the people and the organizations out there in this community working to help other people, particularly, in the issue we're talking about today of housing and homelessness. There are just so many good people doing such good work. So it's just caring people. And I think that's one of the reasons we have such a successful response in our efforts. Obviously, we can always do more. We always want to do better. But, people should be really proud of the work that they're doing. Speaking of work that we're doing and people who should be proud, Casey, can we talk a little bit about your efforts and your team's efforts during the pandemic? Again, that's almost a whole nother show's worth of material, but I know for a fact that, because I was here too, but that you were in here 7 days a week, round the clock for months and months and months once the pandemic started, you and others, kicking into action to help people, both people who were without housing, who were in shelter. That whole system had to be revamped on a dime to protect people. And then the next phase of that was being able to administer federal dollars, to receive some federal dollars and administer tens of millions of dollars to help people who did have housing stay in their housing. And, you and your team were rock stars along with other folks in the community who came together. And so many people were kept safe, who needed help, who needed shelter. So many people were able to stay in their housing. I think at the end of the day, our numbers for evictions were even lower than they had been pre-pandemic in some cases because of the great work that you and the team did. Could you talk a little bit about kind of the shelter, the hotels to housing, et cetera? I know
Sure.
It's a lot, but...
Oh, no, I appreciate that. And thank you for the kind words. It was, as a lot of people experienced, it was a really uncertain time. It was a really frightening time. I feel really fortunate to have been in Dane County during that time because of how seriously folks took the pandemic and how quickly people mobilized in the very early days to do whatever it took to keep people as safe as we could. And one of the ways that we did that was in partnership with the City of Madison, Public Health Madison, Dane County, and of course our frontline agencies and our partners in housing and homelessness, really quickly assessing our facilities. Social distancing was our most important tool at the time, and we knew that our shelters needed more space. Folks may not know this, or they may not remember a time when this was the case, but our men's shelter, for example, was hosted by 3 wonderful church congregations for many, many years, 3 separate spaces within church facilities that on some of the coldest nights had well over 80 people in them. So obviously in the context of a pandemic, that's not a situation where we're going to be able to easily prevent exposure and spread. So we worked with a lot of hotels to acquire a lot of hotel rooms. I think at the peak of the effort, there might have been over 400 rooms or over 400 people in hotel rooms, so that we could create that critical social distancing across the homeless shelter system, particularly to protect people who were extremely vulnerable and people who were considered at high risk of severe illness or death if they had gotten COVID-19. The other thing that we worked to stand up really quickly with our partners was the Isolation and Quarantine Center. That was a hotel, it's still operating now through cold and flu season, where people who were symptomatic, and then later when we had access to testing, people who were confirmed positive, could rest and recover and isolate outside of those congregate shelter settings. We learned a lot of really important lessons in those early days and saw the benefits that even though it was very scary and traumatic and stressful, but people being able to have consistent access to services, people being able to safely isolate, prevented a lot of the spread of illness in the early days that we saw in other communities. And then, the investment of the federal government into our COVID response efforts and us prioritizing those funds in the area of housing and homelessness helped us kind of in that middle phase that's continuing now, which is providing housing opportunities for people who were staying in hotel shelter. And so the creation of the hotels to housing effort, which is up to 2 years worth of rent and case management for people who were sheltering in hotels, that launched in the summer of 2021 and is continuing now. Over 250 people were able to exit from hotel shelter into housing through that program. People who were connected to hotel shelter are still in housing search now, even, and looking for housing and having success transitioning into housing. And then you had mentioned the prevention side of it, having that emergency rental assistance available so that people who had maybe lost their job or couldn't work because maybe their workplace, they had to isolate or quarantine and they couldn't work. All kinds of different hardship that people experienced during the pandemic, reasons why they would need a little help with their rent or the utilities. Having those rental assistance funds was huge as well to prevent a spike in evictions and a large number of people losing their housing and potentially needing our shelter system. Dane County used its early federal stimulus dollars for rental assistance before the federal government created the emergency rental assistance through the American Rescue Plan. And I do think that made a huge difference in 2020 during the pandemic.
Yeah, and a special thanks to Congressman Pocan and Senator Baldwin, who fought really hard for those dollars. it's made such a difference in people's lives. And Casey, so for the rental support for folks who are digging out from the pandemic still at this point, I'm wondering if someone is in a situation where they need some help with rental support, or if they're experiencing homelessness or have a loved one who is, are there a couple of places that are the best places maybe for them to start, just to inquire about what help might be out there for them?
Yeah, so I mentioned the Dane Core program. That's an emergency rental assistance program that will help people with past rent. And if people are experiencing homelessness, there's some security deposit assistance available too. People can learn more about that program at danecore.org. If people call United Way 211, if they don't have access to the internet, United Way can connect them as well to the provider that's right for them. Urban Triage is our partner that works with people who are in communities outside of the city of Madison. And then CAC, or the Community Action Coalition, works with folks who are inside the city of Madison. And then Tenant Resource Center works with people who do have an eviction court process and can provide payments at court and connection to legal assistance at court as well. So that's danecore.org, or call United Way 211 and ask for help with rental assistance, and they should be able to connect you. If people are in need of some of the other resources that we talked about, one of the best ways to get connected is to take a look at the Homeless Service Consortium webpage. That's danecountyhomeless.org. Or people can Google Dane County Homeless Service Consortium. That will have an I Need Help tab that lists if you're an adult man, if you're an adult woman, if you have a family with children, if you need rental assistance, housing navigation. It'll break down all of those resources for you. And then again, calling our friends at United Way at 211 and requesting those services can help get people connected too.
Thanks so much, Casey. Yeah, I think that's the important message, that there is help for folks, and please reach out. One of the, before we wrap up, Casey, one of the things that has certainly happened to me the deeper I've delved into this work, and I'm sure it's something that you and all of our community partners experience, is, sometimes when it's a cold, snowy night and I'm in my home, I almost feel guilty, right? Because you think about the fact that there are still people out there who don't have that and who need our help. And, thank goodness we're able to do what we can, but still it never really leaves, your head. And I'm wondering, for you, kind of on a personal level, do you have any reflections or thoughts you'd like to share about how this work has impacted you personally? Because it's kind of a hard job to just walk away from and forget it, at the end. I would say at 5 o'clock, but you're often here later than that. But at the quote end of the day, when you technically punch the clock.
I appreciate that. I think that one of the biggest things is that I've worked in government service most of my professional career, and it's really been a calling for me. And so this work has really deepened that commitment to serve my community and to give back to others. That guilt that you feel, I've felt it too. I've heard some people say that it's not guilt, but it's maybe recognizing the injustice that exists and the inequality that exists. And so for me, it intensifies that drive to do what I can to partner with agencies that do the work, to partner with elected officials, people in our community, to create that access to opportunity for people. I think there are a couple of things that stand out for me. I remember hearing a homeowner who was able to get a home through the Habitat for Humanity program, talking about how they got the keys to their new home, and the first thing they wanted to do was paint their walls, because they had never lived in a place where they could paint the walls whatever color they wanted. And it was one of those moments where if you have had housing stability for much of your life, you forget, what a privilege that is. So it makes me want to work harder for people. And really, it's a continual education for me, but really eye-opening in terms of recognizing the impacts of systemic racism and self-reflection on what I can do to help dismantle it and call it out where it is. So those have really been the places where it's impacted me the most. And it's really an honor to be able to do this work and to do what I can to try to help people.
Well, Casey, you're a rock star. You're very well respected and known in this community, you and your team, and to all the people you work with in our community who are helping people. If any of you are listening today, thank you so much for making a difference. You're so appreciated. And Casey, you have such a healthy attitude, and you just you use that that observation and that knowledge that suffering exists out there to channel it into something positive. So thank you. And thank you so much for helping, give people an idea of what's going on out there in the issues in the area of housing and homelessness. Thank you for everything you and your team are doing. We really appreciate it. I think this was a very interesting podcast. And is there anything else before we sign off, Casey, that you wanted to mention, or have we said it all?
Yes. No, I mean, my team knows that I would be riddled with worry and guilt if I didn't also thank them. I feel so lucky to get to work with the people that I get to work with every day. And that includes our partners outside of county government too, the staff that we work with at United Way, City of Madison, and all of the agencies that do this really important work. The advocates that help lift up the work that we do and try to advocate for more resources, the people we serve, public who cares about this. So that'll be my parting thought. But just a lot of gratitude for everybody who helps us do this work.
Yeah, it's definitely a team effort. I mean, maybe my final thought that you make me think of here is those advocates, because I remember in my first weeks as county executive, folks who are advocates on behalf of people experiencing homelessness came in to my office and sat down and said, we need a day resource center. We need this, we need that. And we said, okay, let's figure out a way to make it happen. And today, as you mentioned, we have the Beacon, which is such an amazing resource. All I had to do was stand out of the way and let all that great energy make it happen. So this is it's a good community with a lot of people who care. Still a lot of work to do, but there's a lot of good things happening out there and a lot of good progress being made and a lot of people being helped. So Casey, thanks again, and thanks to everyone who joined us today. I hope you found this podcast informative, and I look forward to seeing you next time on the next Dane County Podcast. Thanks.